Hi everyone, happy Monday and welcome to this Grattan Institute 20-minute speed briefing. I'm Danielle Wood, CEO of the Grattan Institute. I would like to start by acknowledging the traditional custodians of the various lands from which we join this webinar today and pay my respects to their elders past, present and emerging. Today I am joined in speaking all things vaccines and the latest Grattan report on the vaccine plan, Race to 80, our best shot at living with COVID, by two colleagues and co-authors, Grattan Health Program Director Stephen Duckett and Associate Tom Crowley. Thanks and welcome Stephen and Tom. I would also like to acknowledge the contribution of our excellent co-authors, Brendan Coates, Will Mackey and Annika Stobart. So I know you are all busy people. I'm going to give a short presentation on the highlights package of the report. I'm then going to moderate questions that you put in the Q&A to Stephen and Tom. So you know the drill now. Please put forward your questions early. The earlier you go, the best shot you have of having your question put to the panel. And I ask that you try and keep them as short and snappy as possible in keeping with the 20-minute time frame today. So I am going to share my screen. Hopefully everyone has that in front of them. Really the key messages of our report is, first of all, that the zero COVID strategy has served us well. It's meant that we've had better health and economic outcomes than much of the rest of the world. But clearly it comes at a cost. Our borders are closed, we're shut off from friends and family overseas, and we've had to rely on sometimes very intrusive public health measures like lockdowns to contain the virus. Vaccines give us a way out. So two challenges for the country: really work out what the coverage threshold is that we're comfortable starting to reopen, and then get vaccines to that level as quickly as possible. And really those were the two things we were grappling with in the report. Where did we come out? We recommended that we don't start taking those steps towards reopening until 80% of the population is vaccinated and about 95% for higher risk groups like over 70. Why 80? That was the point we thought we could be comfortable that we'd really broken the link between cases and widespread negative health outcomes, and we're particularly concerned about the risk of overwhelming ICU. So we don't know the transmissibility of the virus, but we modelled it under a number of different assumptions. In our middle assumption, you can see here, we do end up with COVID infections in the community, but we don't come anywhere near close to ICU capacity range, and we have only a small number of deaths. At 80% vaccination, even with a high transmissibility scenarios, this was our higher end one, yes, we end up with a large number of cases, but again, we don't come close to that ICU capacity, and the number of deaths is sort of just a bit worse than a bad flu season. Why not 70? Things could be fine if we opened up at 70, and certainly in our median scenario, we don't overwhelm ICU. Death numbers are higher, but the real concern, of course, is if we end up with in the higher transmissibility world. In that world, if we opened at 70, we would overwhelm our ICU capacity and end up with a large number of COVID and non-COVID related deaths. What we know is that governments do not tolerate that happening. That could trigger another round of lockdowns. So our message is really, we only open up once, let's do it right. And we argue that the precautionary principle really would suggest pushing to get to 80. And the good news is that we think 80 is imminently achievable. Only 10% of Australians say that they're really against getting a COVID vaccine. Another 30 or 35% are waiting. So that's the movable middle that we think we need to be targeting. When we look overseas, we can see other countries like Singapore, Canada, UK, already over 70% on first doses. Yes, the rates are slowing, but that's partly because they're capping out in those vulnerable age groups. Over 60s in the UK have over 90% vaccine take-up. And take-up is still rising amongst younger age groups that have had access for less time. And that does not include access for children, which is now starting to happen. So we think they will sail over that 80% mark. The other good piece of news is supply constraints are going to cease to be a problem. It has been a binding constraint to date, but more and more Pfizer in particular is coming into the country, and we will have enough vaccine to vaccinate 80% of the population fully by the end of this year. So how quickly can we get there? So taking into account that supply, taking into account the kind of ramping up we saw in uptake in places like the UK, We think we could be there by the end of the year if a vaccine becomes approved and distributed for younger children under 12. Currently, Pfizer is in phase 3 trials for that age group. If that doesn't happen by the end of the year, we think March 2022 is a more realistic target. What do we need to do to get there? First, we have to ramp up logistics. Government is still anticipating that most will go out through the GP network. We argue GPs are incredibly important, but we need to have more diversified distribution, both for people's convenience and to speed up the rollout. So that means doing more through state vaccination centres and then looking for other distribution networks like workplaces, schools, pharmacies, localised distributions in community centres and town halls and pop-up clinics at transport stations. We want to make getting a vaccine as easy as possible to do. Second, we need much more effective messaging. So that means major national campaigns to drive take-up. We know a lot about what is making hesitant people hesitant. So we can use that information to help tailor those campaigns. But we also need to have much more targeted campaigns at different groups that are hesitant. And certainly the data suggests women, younger people, people from culturally and linguistically diverse communities. Thirdly, we need to provide incentives. So let's talk carrots and sticks. So we recommend a lottery to run through November and December, $10 million weekly prize. So it's 10 $1 million prizes once a week. You get one entry if you've had one shot, 2 entries if you've had 2 shots, and anyone that's had the vaccine up to the starting time for the lottery can enter. We also recommend temporary vaccine passports, so proof of vaccination to go into higher risk settings like restaurants or entertainment venues or big sporting events. That will obviously provide an incentive to get vaccinated, but it also helps reduce the risks in that interim period before we've reached herd immunity in the community. And we also think mandatory vaccination for selected workers in high risk settings should be on the table. So the plan, once we get to 80%, we can remove quarantine for fully vaccinated Australians. Australians can come and go at will if they've had the vaccine. We should be pushing more bubble arrangements with low-risk countries. Those people could also come without quarantine. And at that point, we can be comfortable removing all intrusive domestic restrictions. No more lockdowns, no more border closures, no more density limits. We should continue to ramp up vaccinations after that point, though. Once we get to 85%, we're confident you could remove all border restrictions for vaccinated people. We do recommend maintaining quarantine for a period for unvaccinated arrivals. And really, we should continually be looking to secure and distribute new vaccines and boosters as they become available. So that is the quick run through. That is Grattan's plan. Stephen, on Friday, the National Cabinet released their own plan, which is summarised in this slide. Can you take us through the major elements of that plan and your initial reaction to it?
So thanks, Danny. So we've got up there a slide of the government's so-called plan, 4 phases. And why do I say it's a so-called plan? Well, it's a so-called plan because it's vague and it's really unclear about what is going to happen when. And to the extent we know what is going to happen when, it's a risky plan. So if you look at the top there, the current phase, then the first transition phase is so-called phase B, where they talk about 70% of the eligible population being vaccinated. By eligible population, they mean people over 16. I'm not entirely sure why they chose that number. People who are eligible for vaccine in Australia is now people over 12. The Therapeutic Goods Administration has approved a vaccine for 12 to 16-year-olds. It is a really peculiar number because everybody transmits. It is possible for anybody to transmit the virus. And so when you're talking about herd immunity, you're talking about the whole population. A rate of 70% translates as 56% of the population, which on our modelling is pretty risky and leads to very high levels of ICU use and deaths. The phase C is 64% of the population. They call it 80% of the eligible population. The other thing is the uncertainty. You'll see that the first line of the plan says the measures may include. We've got no idea whether they will include them or not. One of the elements of phase B is that they're going to ease restrictions on vaccinated residents, brackets TBD, to be determined. There's another one which says in phase C that they're going to have lockdowns less likely but possible. So it's riddled with these vagaries. So we really don't know what the plan is. It's still, I think, more of a thought bubble than a plan. Thank you.
Thanks, Stephen. Tom, you've also spent some time having a look at the plan. Do you have any additional comments you'd like to make about some of the risks of the plan?
I do. I think the most important thing to point out is that point about the risk, Danny. And I think that the government is proposing to take a very big gamble here, particularly in stage B. And it's something that has been potentially underappreciated in the way that the coverage has unfolded over the last couple of days. We can't see the modelling. It would be great if we could see the modelling. It's possible that the stage C target is sort of informed by the modelling as something that is relatively safe. But stage B is very clearly quite a risky level. 56% vaccine coverage for the whole population is very low. It's a point where COVID can get out of control and it can overwhelm your hospitals. And the plan seems to suggest that this is the point at which the tap will be turned on, at a point where the house can, if you like, still be flooded. So that is quite dangerous. And then on top of that, we're proposing to start taking public health measures off the table. And we're proposing this kind of wait and see approach where you only use restrictions if they're needed. It's a very dangerous formula. And really, I think it's the kind of middle ground fallacy that we keep bumping up against in this COVID debate. I think that people have the idea sometimes that we're deciding how much COVID we want, but we don't get to choose that. What we choose is how much risk tolerance we have for a lot of COVID. And at this point, at opening up at something like 56%, beginning to take any steps to let COVID into the community, that risk is still very real, that risk of overwhelming the health system. And we only get to do this once. And so if we do kind of, end up on the wrong end of that risk calculation and the health system is threatened, the wait and see approach and having some instruments taken off the table is going to leave us in a very precarious position. It might need more restrictions to be able to keep the health system under control. It's exactly the kind of thing that we're seeing unfolding in New South Wales at the moment. So I think it's a really dangerous way to go. And to be honest, I don't really think that the states, when push comes to shove, will go for it. I get the sense that state governments have been very eager to protect their health systems at all costs so far in the crisis, and they have learnt that this sort of wait and see approach doesn't work. So I think that the kind of little bit of column A, a little bit of column B in this plan at the moment is not really a sustainable or very sensible way to proceed.
Yeah, fantastic. Thank you. So lots of brilliant questions coming in. I'll try and get to as many people as I can. Stephen, I'm going to start with a hard one for you from Richard Farber. Do you think the Australian population will tolerate any level of deaths, even if much less than the seasonal flu? Have deaths from COVID become politically unacceptable?
I think it's a really good question, and one I saw and decided not to answer online because I think it is worth exploring. We think that the public has shown that it's prepared to accept a given level of flu deaths every year as part of normal way of life, normal course of life. In our modelling, the estimates of deaths for an 80% opening, which is what we are recommending, was roughly the same, almost identical, as the number of flu deaths in 2010. So it's not a good flu season. Well, the last couple of years we've had good flu seasons because of the COVID restrictions, but typically a good flu season is 1,000 deaths, a bad flu season, 4,000 or 5,000. But, this is a moderate flu season. I think part of the issue is not just the deaths, but the fear of any number of cases. And I think we've got to shift the thinking to say, look, cases are not as bad as they used to be. Last year and so far this year, cases equals hospitalisations equals deaths. The whole point of a vaccine is it means that cases don't equal hospitalisations, don't equal deaths. And so we've got to actually do some mindset. And I think you're absolutely right. We've got to have some messaging to actually bring the public along that that's the sort of thing that needs to happen. Fantastic.
Thanks, Stephen. The top question at the moment from Stuart Hamilton, which I can answer. Have you seen the Doherty modelling, which is said to have underplanned the National Cabinet plan? The answer to that is no, Stuart. We've been told it will be released. We're certainly hoping it's released in the form that Doherty gave to the National Cabinet and not a sanitised version. I think it's really important for the Australian public to be able to see that, because we want to understand the kind of risk trade-off that the National Cabinet's made, and we will only be able to know that for sure when we see the Doherty numbers. Tom, I'm going to put a question to you, which is a nice general one, I think, from Heather Moorcroft. Was there a finding or recommendation in this report that surprised you?
I think maybe the thing, and the thing, interestingly, speaking to kind of friends and other people who've engaged with our report over the last few days, I think the thing that really surprised me is how very small, well, seemingly very small changes in vaccination rates can make very big differences. And the difference between 70% in some of our scenarios and 80% being so stark, and also between different assumptions that you make about the transmissibility of the Delta variant. I think that when you're, kind of playing with fire with something that particularly with Delta is just sort of so contagious, and really, if you kind of get the balance wrong, can kind of overwhelm systems very quickly. I was quite surprised at how sensitive projections were to kind of small differences. And I think that kind of informed, if you like, the precautionary principle that we decided to use in picking a level like 80%, where we were really confident that you wouldn't need any sort of onerous restrictions at that point, because we kind of, in all plausible scenarios, kind of made sure that we were comfortable with the outcomes there. So I think that's probably the one that I dominate, although there are plenty of other interesting ones that
Yeah, I agree. I also found that quite incredible. Stephen, one here from Tammy Wilson. This will be really important. What is the strategy for children's vaccinations? Is there a danger that disease will take hold in children and spread through the general population if they are not widely vaccinated?
Yes, so that's exactly why a eligible population number is the wrong number to think about. Herd immunity is herd immunity, the whole herd, if you think about it. So at the moment, there is a vaccine for everybody over 12. Pfizer vaccine is approved for 12 and up. Pfizer has said they're going to submit to the Food and Drug Administration in the US their trial results for a vaccine for people under 12. The FDA, as I understand it, has said they want to have more data. They want them to expand the size of the trial. So it may or may not be submitted in Australia by the end of this calendar year. But in any event, let's say there is a vaccine for 2 to 11-year-olds, that's really good. Let's say there's not a vaccine for 2 to 11-year-olds, for kids under 12, then we need to actually think of different public health interventions, including, we've recommended, for example, rapid antigen testing, either every day or every second day at schools, for example. And of course, the rapid antigen test is not as good as the PCR test, but it's quick, cheap, and can be used widespread. Before you walk into the school, before you go into preschool, you've got to have that test. So we've got to continue public health measures for the school kids and risky venues, but that's where we'll be. But if we have 80% immunised, then the virus won't be able to spread to the kids as much as to anybody else.
Fantastic. So the most popular question currently is from a Brendan Coates. I'm not sure if that is the the real Brendan Coates or someone taking his identity, but Tom, I'll put it to you. What happens if your vaccine target of 80% can't be reached? Is this a recipe for staying closed forever?
Thanks, Danny, and thanks, Brendan. I think that the way that we have thought about that question is that what our report seeks to do is to identify what the best path out is for Australia, and then say, this is the good path. This is the path that lets you remove restrictions at the same time as avoiding significant health costs. So we should set that as our goal, and we should be ambitious to reach it. And I think that sort of framing is really important. We absolutely do think that 80% is achievable. I think that's also really important to emphasise. We have enough supply. We have 90% of Australians say that they want one. There are plenty of things that governments could be doing better in terms of messaging and logistics and incentives that would get us there. So I'm very optimistic that a high level like that can actually be achieved. But I think that the way that we're sort of framing it is, we recognise we can't and won't stay closed forever. So getting to something like 80% as quickly as possible so that we can safely remove restrictions is the best way forward. And it's kind of the only safe path forward to kind of, navigate this difficult, it's not an easy choice, but that sort of, failure is not an option is maybe the language that we've been using.
Fantastic. And a lucky last question to you, Stephen, from Martine Letts, who says, as this is going to be an ongoing challenge with boosters likely to be needed in the longer term, why not make vaccine passports mandatory?
So there's a trade-off with vaccine passports. They're intrusive and impact on people's liberties. On the other hand, they have two really positive things. First of all, in the context of potential outbreaks and so on, they reduce the risk of spread because the people who are the highest risk of spread that is the unvaccinated, are kept separate from the places which are the highest risk of spread, such as nightclubs, festivals, cricket matches, etc., etc. So they've got a public health benefit, and of course also they've got an incentive benefit. That is, people who want to go to those places are then more likely to be be vaccinated. So yes, I think vaccine passports have an important role and will forever.
Fantastic. Thank you. I'm going to wrap it up there. Thank you so much, everyone, for coming. Thank you particularly to Stephen and Tom for sharing their expertise. If you want to know more about that Grattan report, please visit our website, www.grattan.edu.au. If you are interested in the modelling for this report, and I did see some questions coming in there on the ref numbers, the reproduction numbers, there will be a detailed event on the modelling on Thursday this afternoon. So you can also find details about that on the website. Thank you, everyone, and have a lovely afternoon.